so much, Maude, for agreeing to talk with rabble.ca. And we just had a great session this morning with a number of stakeholders and key advocates for Medicare. We're here on the eve of the Premier's Conference in Victoria. And I guess the first question that I wanted to ask you is, you as the head of the Council of Canadians and all of your vast membership across the country, you guys have really taken this on, our healthcare system, and defending Medicare and wanting to see it get better. Why is it so important to the Council of Canadians?
You know, it's been one of our core campaigns since we got started 26 and a half years ago, if you can believe it. When we first came together was to fight the Canada-US Free Trade Agreement, which was the predecessor to NAFTA. And my concern at that time, I didn't know anything about water, energy, anything. It was social programs, and it was what these trade agreements and globalization were going to do to our social programs. And we've watched every single one get stripped. In one way or another. The only one that's really left standing as a universal social program is our Medicare, is our healthcare system. And so we are very, very deeply committed to fighting to maintain it and to deepen and strengthen it. Our members are very passionate about this issue. They care about a lot of issues, but this is just absolutely core. This Medicare reflects our Canadian values. There's a recent poll by the Canadian Health, not done by the Canadian Health Coalition, but commissioned by them, that found that 94% of Canadians support public health care. Now, I know that Stephen Harper knows this, and that he doesn't dare then come at health care directly. What he has to do is come at it through the back door by pulling out the rug under the financing and letting the provinces do the dirty work. So it is extremely important for us to come together as the NDP, as the Council, as the Canadian Health Coalition and others, frontline healthcare workers and so on, to say this is our healthcare system, hands off except to improve it. You must maintain and strengthen the federal role in healthcare, because it is not only key to our members, but I think it's absolutely key value, a key cornerstone of our values for every single Canadian.
What will be your message to the premiers who are meeting? I mean, we know they're facing this situation where the finance minister made a unilateral decision on funding, so that the federal government, as you say, is clearly moving away from the table. They're backing out of healthcare. Right. So what will your message be to the premiers?
Our message to the premiers is that there are some of them who are going to support this, and we're saying don't you dare do this. I mean, some of them are more than others likely to say, well, we kind of agree with cutting up Medicare into 13 jurisdictions, or healthcare into 13 jurisdictions, and this is just a nice stepping stone. So the people of those provinces are going to be watching their governments like a hawk, because left, right, or center, people in this country want public health care, and this is what these premiers have to hear. For the premiers who stand with us on this, we are going to say you must be a united front. You're not alone. The people of Canada are with you. These organizations are going to be outstanding here with you. And even though Stephen Harper has technically a majority because of the way our system works at the moment, it does not give him the right to ram through the beginning of the end, a program of the beginning of the end of Medicare, just because he happens not to like it and prefers private health care. It's just simply not on, and we have to make a united front with the provinces, and we need them together with each other, and we need them together with the people.
One last question on the issue of accountability. We did see commitments that were made in 2003, 2004 health accords. Really very little progress has been made, but it does seem to me that we've got a real strong hook there to hammer away at accountability, both on the federal level and on the provincial level, because they made those commitments to Canadians.
They did.
And they haven't delivered.
They haven't. Not on pharmacare, not on home care, not on extending primary care, all the areas that they agreed with and identified as the issues. And as you've pointed out, Libby, that left, right, or center, Canadians can see that we need some fundamental changes to the delivery of our health care. We're not talking about the public, the notion that it's public or that the federal government has a strong role, but how we deliver and more primary care, better home care, and a national pharmacare program we absolutely need. And I think that, again, this is a message that the premiers have to hear, is that we got the 2004 Accord, started the process of this, and we want to deepen, strengthen, and extend it in the 2014 Accord. And that's what they're here for, and that's what we're here for.
Well, thank you very much, Maude. I'm very glad you're here, because you are a very strong voice for Canadians right across the country, and your presence here. You know, I think it does represent the public interest, which sometimes gets lost.
And
so,
we're stubborn, too,
all power to you. Yes. All right. Good luck.